Is knee pain making your life miserable? Affordable knee surgery in Tijuana can help.
Surgeries to repair meniscus, ACL, and PCL knee replacement.
But which surgery do you need? Are you even a candidate? We sat down with one of Tijuana's top orthopedic surgeons to get you real answers in just 15 minutes.
My name is Dr. Hans Ruiz Cernak. I'm a traumatologist and orthopedic surgeon. I make my studies in Mexico City. The name is UNAM. It's one of the highest ranking university in Mexico.
Who is a good candidate for knee replacement and who is not a good candidate for this?
The surgery to replace the knee or total knee replacement is a very, very good surgery that we can do to eliminate the pain in the knee when we don't have cartilage or the damage in the knee is very advanced, it's very high. So to kill the pain, we have to remove the cartilage and replace it for implants. The best patients to accept the implants are patients that take care of the weight, patients that have no disease like diabetes, high blood pressure, people that are not taking blood thinners or anticoagulants are the best patients. But in the reality, the most people that need a knee replacement are people that have obesity, some disease like high blood pressure, diabetes. So what I do is accept the most people. There is no matter if the patient have obesity or something or some disease. If they accept the risk, I can do the surgery, because the reality is that people that is healthy, that most people don't have problems in the knees or in the hip. Old people is a good patient for me. All patients are good for a knee replacement, but I prefer to see all the information about the patient, about the medicines that they are taking, all the disease, all the medical records. Okay, after that I can take a decision if I accept the patient to come with me to make the surgery.
What are the alternatives or what are the things you should do before you consider knee replacement?
My advice, if you have pain in your knee, after you go to the doctor, a doctor determine if you have a kind of damage in the cartilage, and before you need a knee replacement, maybe you can try to avoid the exercises with weight. You have to avoid jumping jacks, running a lot in the week. With that, you can diminish the damage in there and you can stop the damage in the cartilage. I have another advice. You can try with taking hyaluronic acid.
Hyaluronic acid?
Yeah, or maybe you can try glucosamine, chondroitin, collagen, type 2 of collagen, or hydrolyzed collagen is very good for your knees. You have to keep taking it every day for 6 to 12 months to feel that the treatment is working in your knees. I highly recommend, if you feel pain in the knees, to avoid the weight, the excessive weight. If you have more weight that you have to be, you have to lose weight to feel much better. That's gonna be very, very good for you and your knees. Another thing you can do to diminish the pain in the knee is you have to avoid sugar. You wanna improve the repairing or the fixing of the cartilage by your body. If you avoid sugar, you have to avoid processed food. That's gonna be very, very good for your cartilage in your knees.
When somebody comes here for knee replacement, for how many days do they need to come? What are the steps? What happens day 1, day 2, day 3? Can you walk us through that, please?
Once we accept a patient to make the total knee replacement, you will fly or you will come to Tijuana. The first day you have to arrive fasting in the morning, so we can take the blood samples in the lab. After that, we're gonna make a test of your lungs, of your heart, and a physician specialist in that in heart is gonna make a valorization, and he's gonna determine what's the risk of the surgery. After that, you're gonna come with me to my office so we can talk face to face, and I can answer all your questions about the risk, about the surgery, about everything you can ask about everything. After that, you can go to the hotel, and the next day we can do the surgery. I prefer to make the surgeries in the morning because everything is better in the morning. People have more energy, and we can do the surgery much better in the morning. We make the surgery more, usually we can make the surgery at 9 o'clock in the morning, and we can finish 11 to 12 o'clock. After that, I go to your room to explain to your partner how about the surgery was and how everything is happening in your knee. We can talk about the sizes of the implants I put, and after that, you are gonna be in a recovery room for 2 hours. After 2 hours, you will come to your room with your partner to stay there one night. The next day after surgery, I remove the drain of your knee, and I begin to move your knee, flex and extend. If you feel comfortable enough, you can extend and walk. The next day after surgery, if I see that you don't have fever, you are not bleeding, your wound it's okay, I can make the discharge. I'm gonna give you a prescription to buy antibiotics, anti-inflammatories, and painkillers, and after that you can go home. In some cases, it's better to stay here in a hotel after the discharge of the hospital for 2 or 3 days to diminish the risk of thrombosis. If you have to fly to back home, it's better if you stay here for 2 or 3 days after surgery.
Any physiotherapy program or physiotherapy that you do or teach them?
The next day after surgery, once I remove the drain, my physiotherapy people come with you and they make some exercises for you. This person is gonna explain you how you will make the exercises, and if you feel comfortable and you want to stay here Tijuana for 2 weeks, if it's okay for you, you can come to the physiotherapy center to continue the exercises. This is gonna improve your advance very high. If you will come back very fast to home, we can make you a plan of exercises before you go to a physiotherapy center in your home.
Can you share what are the things one can do or one should do to increase the chances of success in a knee replacement?
The total knee replacement is a surgery very safe to the implants. The materials are very safe, but in some cases that surgery can not go well after some years. So to improve that prognosis after surgery and increase the durability of the implants, you have to take care of your weight. Your weight is the key of this surgery. If you take care of diabetes, high blood pressure, you can raise that durability of the implants. You can use the prosthesis. You can walk, you can run if you need it. If you run like a marathon or something like that, Ironman, the implants is gonna last a little less. If you can avoid that, the implants is gonna last a long time.
Can you talk a little bit about what are the different brands of knee implants that you use over here, brands, and if you have models?
Usually I use brands like Stryker, Biomed, and Johnson and Johnson prosthesis. The implants are made, most of them, in the United States. There are other brands that are cheaper. Sometimes are cheaper, and they come from India, China, Korea. That implants are very good too. I can decide to use a brand depending the weight of the patient and the budget. If the patient don't have a very good budget to buy the best prosthesis or the more expensive, I can use another brand. All the brands are very good, but I try to avoid some brands if they don't have more than 10 years in the market. I don't feel safe enough with that implant, so I avoid it. It's a joint very complex because we have a lot of parts in there. So we can have fractures in the bone, damage in the cartilage in these parts, damage in the meniscus. The meniscus are very common. Another kind of damage is the ACL and PCL in the posterior part, posterior side of the knee. So we can make all the surgeries to repair meniscus, ACL, and PCL too. So if the patient feel comfortable enough, we can use ligament graft of another person, or we can use ligament graft of the same patient, depending on the decision of the patient. So to replace the ACL, the PCL, even the meniscus, if the meniscus is too damaged. If the damage in the meniscus is starting, we can fix it with some sutures in there and some stitches in there, and the patient can improve in more or less, if don't have too much damage, in 6 weeks, and if the patient have a lot of damage, in 3 months. After that, the patient can come back to work and can come back to the exercises.
So, for how long does a person need to come for a ACL?
To repair an ACL, we need 3 days. You have to travel, you have to arrive fasting in the morning, we have to take all the pre-ops. If you already have the MRI, we can use it, or if you don't have it, we have to take the MRI 1 day before surgery to take the decisions in the plan and how we are going to fix the damage. The second day we make the surgery, and the third day you can come back home. It's very easy. The most time we do a very small wounds. We make all the surgery arthroscopic, so the pain after surgery is very small.
And what about meniscus repair? For meniscus, how many days do they have to come?
For meniscus repair, we need 3 days too. If you cannot stay in Tijuana too many days, only 2 maybe, you can make all the tests at home, and you can bring me before surgery, blood test, the MRI. If you have everything, we can do the surgery in only 2 days.
Want alternatives to knee surgery? Watch his full interview here.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.